Hi, it's Dr. Coates at Naturopathic Specialist, and I'm very excited to have my guest tonight, which is Dr. Mona Amini. And you are a psychiatrist, correct?
I am, yes.
And we are very excited to kind of talk about, well, number one, how we met each other. We were met through a mutual patient, which is awesome. It was really great to meet you, and I'm excited to refer patients to you. We want to talk about, obviously, the mind-body journey of cancer and how it's really important to get a lot of that out. Many of us, bottle a lot of stuff up, and that's not healthy, and that can affect our immune systems. And I want to make sure that we, explore all the other things of wellness that we can. And I know that's a big center of your practice, which I loved, and which is why we resonated so well when we chatted. So we will dive right in. Do you want to introduce yourself in any way?
Absolutely. Yeah. First, I'd love to say thank you and my debt of gratitude to you. Thank you for having me today or this evening. So I'm Dr. Mona Amini. I'm the founder of Monvi Mind Wellness in Scottsdale, Arizona. I am an adult psychiatrist by trade. I dabble in a lot of different things, wear many hats, including thought leadership and social media engagement as well. But I'm all about more practicalities of mental health and mind wellness, and I'm excited to be here.
Yes, we're thankful. And one of the things I know we chatted about when we had our introduction with each other was just you will happily dive into some of the hard subjects too, which I like, and I do that as well with my patients. I'm not afraid to ask about what's going on at home, you know, what do you, when you're looking at yourself in the mirror, what's going on in the bedroom sometimes, there's a lot of things that go on with a cancer journey when your body has changed that other doctors will not talk to you about, and it needs to be talked about. So I'm excited. What inspired you to become a psychiatrist?
I am so deeply, profoundly, and sometimes too much in the psychology of the mind and how it affects the body. I've always had that just what that impact is, and I've had that passion for many years, even before med school. So when I went into med school, I know immediately that I wanted to go into psychiatry for that very reason. And I felt that psychiatry in that state, and even today's state, is the forefront of medicine because of that mind-body connection and what we can do to really impact in a profoundly positive way when we can help our patients and just help them on their lifestyle journey and just their seasons of life, because it is very waxing and waning. You're never going to have a very neutral, happy, euphoric life, right? From birth to end of life. So it's about that journey and helping with that. And I really love being a part of that journey for my patients.
Yeah, and I think that's really important, beyond us diving into the metabolic, what is making your cancer tick, and what are the markers, and what can we do to modify it. I mean, I've enjoyed looking into neurotransmitters. I've done neurotransmitter testing to kind of look at serotonin and dopamine and all of those things too. And then obviously you can talk about what affects that as well. So it's great. So a lot of patients, who have been with us a long time know what to expect in our office, right? We meet with our patients for a long time. We have long visits as naturopaths, so we usually have like an hour visit, 45-minute visit. To paint a picture of what you do in your practice and how you meet with patients.
I opened up my concierge practice, this Monvi Mind Wellness, a little over a year ago, and that was exactly the preface of why I wanted to have a private pay concierge practice, because I wanted to spend time with my patients. I think that just taking them on a journey of a 5 to 10 minute follow-up visit is not enough. You barely can cross the barrier of, how are you doing today, let alone how have you been doing for the cusp of the last month, 2, 3, months at a time. So when they first see me in the office, they are seeing me for an hour and a half to 2 hours. That's their initial visit, and I'm going through what you had referred to as really hard questions, and evaluating that time span, not only their timeline of childhood, adolescence, but also where they're at now, what their goals are in the future as well. And sometimes those are hard conversations about lifestyle and, sexual intimacy, their relationships, whether that be friendships or, intimate partners, and then, other lifestyle factors as well. And then follow-up visits are either virtual or in the office. At minimum, I spend 30 minutes with my patients, but I do offer more therapy as well. So if they're looking into more therapeutic and their talk therapy, we do mindfulness in the office as well. I have 50-minute visits too.
Okay.
Yeah.
That's great. What do you mean when you say that you're not typical as a psychiatrist, which I think is a great tagline. I like that.
That's my trademark tagline. So this was more so talking about the impact of just psychiatry in general and speaking to more along the lines in the realm of I'm just not your typical psychiatrist. I'm sharing with the world now my passions about what's helped me on my personal journey, what I've seen has helped others on their own personal journeys that I've helped, impact or facilitated. And that sometimes means music is therapy. It might mean dance is therapy. It might mean having those crucial conversations with yourself, checking in with yourself. A lot of like wellness strategies and lifestyle factors in there. So I am one of those physicians where I don't like to be pigeonholed and called a certain subset of a practitioner. So you have to be integrative, you have to be holistic, you have to be this, that. I customize my strategies per each patient and who is walking through the door. Not everyone wants or needs holistic or integrated practices, but others may like that and they're more inclined to enjoy that as more of a measure. So talking about supplements, lifestyle changes, therapies, not just, psychiatric meds.
Yeah, well, that's good.
Yes.
Yeah, we definitely, obviously, here talk a lot about diet and movement. We even have someone who does Qigong in our office. And we, supplements are supplements, but you need to know it's individualized to every person.
Right.
Someone that has breast cancer will be on something completely different maybe than another patient that has breast cancer and vice versa. And similarly, like you're saying, and that's what I liked is that you look at it similar to the way we do, is that it's individualized to each person and their needs. And some people need a lot of everything. And some people need very, direct certain things. And that's great, and so I like that. And that's exciting, to be on the same plan. Yeah. You had on here to share one mantra or guiding principle, which I think is great about mind wellness that everyone should know. What would you think that is?
I think that there is no one-stop solution. I think that we are, unfortunately, in our society today, there's a lot of push of this particular regimen or this particular tool will help all people and humanity and men, women of all ages, of all sizes. No, it doesn't work that way. Even with, in my practice historically, clinically, if I had 5 to 10 patients in one room and we lined them up and I provided them with a specific antidepressant, each of them the same dose, the same particular antidepressant, we know maybe not all of them are going to have the same reaction or positive results, if at all, and they might have side effects. So in terms of that, looking at it with a very different lens and looking at it through a whole person experience. So my mantra really is customizing things to the patient, to your client, whomever is in front of you for that particular visit. And clinically, overall, we need to shed some more light on that and implement these types of discussions with lifestyle factors at play. And life is not about always instant gratification.
For sure. And I know I have patients who come to me who want to get off those meds.
Yes.
Do you help with that as well?
I do. Okay. Yes. Actually, I do a good dose of that, because what may commonly happen is that some of the patients are coming from different types of practices, whether or not that was their own family practitioner, sometimes a neurologist, an ND, whomever it is, and who initiated some medications. And then if they're interested in kind of implementing these other types of practices that I'm more, talking about, like are more impactful in their well-being, then slowly but surely we end up lightening the load, if you will, of the medications, of doses, weaning them off. And to me, that is more of a practical step and really longitudinally helping them in their life.
Yeah. I mean, I definitely will not very often, but once in a while I will prescribe one of those meds if it's needed.
Sure.
And sometimes it's short term and sometimes it turns into long term.
Yeah.
And we have training too to try and, use alternatives and obviously help people get off. But sometimes it's really hard and they need more intervention. So it's nice to have, help with that as well. So that's great.
Yeah.
How do you blend what you do traditionally as a psychiatrist and then integrative things like what we do, when we talk about nutrition and supplements and all that? I mean, obviously you're individualizing it, as you said. Is there any other way that you blend it differently, you think, than others?
I don't think I do anything different than others. I think that, again, it's more of that customization and the personalization of everything. Because not everyone is inclined, at least at the time that maybe they're starting with me in practice, to change some of those things. It's hard. Change is hard. Yeah. We all know that, right? I'm not going to expect you to go to the gym from 0 to 5 days a week immediately after seeing me. Yeah. Or change your friendship circle or the people around you because they're not really great around you and not, and suddenly stop any of your alcohol drinking that you were, drinking 3-4 glasses of wine a night. Those expectations have to just be mindful, and their progress, and they're just about consistent measures and tools. And these are just things in practice over my span of 10, 11 years or more of clinical practice that I've seen. These are adjustments needing to be made, and here's things that are going to positively impact my patients. And how am I going to have these conversations with them to help lead them in the right direction? Because some people, need some motivational interviewing, and others, no, they're very stringent. There's a reason why they're coming to see me, because all of the other traditional methods just didn't work for them, and they're wanting to take a bigger leap and a bigger step.
That makes sense. I mean, we find that here as well. Patients have tried many things and they're ready to do something different, and that's good, and that's what I find about our patients too. They're very motivated, obviously, with a cancer diagnosis. Yeah. And not all of our patients have cancer, but a lot of them do. And so it definitely is a motivating factor for change. Yeah. But obviously, patients come in and they're always scared, like, you're going to make me become, I don't know, a vegan tomorrow or all this. And I'm like, no.
I can't go gluten-free tomorrow.
Where you're at, and we will do it as a process if that's what's in your best interest. I don't know that is, so... Not that veganism is bad. I'm just saying, it just requires steps and understanding where someone is at. Sometimes it's just like, I just want you to drink more water, and that could be the biggest step that we make in the day. So that's great.
And that might be very difficult for people. We've had those conversations with my patients too, just getting some more hydration.
Just start there. There is sometimes a stigma or a misconception about psychiatry or seeing someone, you're like, oh, you're going to go see your shrink and all that. I think it's changed a little bit over time. I think it is definitely better accepted now. A lot of patients I see have talked to someone, and if they haven't, I encourage them to, because it is really important to not, especially when you're going through a chronic disease situation, to not vent to your family always. Right. And obviously not everyone has the ability to go see someone, and I understand that too, but if they can, getting someone outside of their close-knit group is good, because you're not as emotionally involved, obviously, and that makes it a lot easier to vent and get it out, and you can subjectively talk back to them about it. So Do you feel like there is a misconception still? Talk about that.
I think it's still there. I think it is still pretty rampant in different generations that I've been noticing more so. And that was a big reason why I decided to kind of go out on the social media realm and talk about things a little bit more on a practical level so that I can impact those individuals that are maybe a bit more cautious about anyone in mental health. It's not just a psychiatrist alone.
For sure.
So there is still stigma. I think it's getting better because we're seeing a lot more celebrities and athletes and organizations talking about this a bit more. But there's also that, well, I'm not as severe or I'm not bipolar or schizophrenic to have to see a psychiatrist.
Yeah.
And I hear this all the time. And again, it's about little tools and having a little bit of giving advice and providing little steps because individuals that really need it, I really want them to feel comfortable to see a psychiatrist eventually, whomever it is. If it's not me, I want them to see somebody. Because that will help them in their life if needed. But it's definitely something that, it's getting better.
Yeah, and there's obviously lots of different types of people to see that do different types of therapy, which is the great part about it. And I've told patients too, especially if they're is to interview a couple of different people and find who you resonate with, because you don't want to go to talk to someone about your deepest, darkest things if you don't like them or you don't feel comfortable with them, not because you need to be their best friend, but that you just need to feel comfortable sharing that.
Sure.
And, I'm grateful that many of my patients are willing to share the things that they do with me. And I understand if some people don't want to share too, and that's okay.
Exactly.
Got to be ready.
You've got to be ready.
That's fine. I know what's missing in some of the conventional medicine that we deal with sometimes. As a naturopath, we this is part of it. The mind-body connection and talking about some of the hard things. What do you think is missing in traditional psychiatry today that other than
honestly,
what we've already been talking about?
That mind-body connection. That how diet in particular
it's huge.
Dramatically affects the body and the mind. And I think that those are, again, with social media and all of this information age, all of these tools and education is delivered and coming out. It's a lot of brain dumping on the public, though. So it's a matter of, okay, how can we really provide feasible and practical options to people that these are, ways to navigate it, because there's so much information. Now it's overload, right? Who do you follow? Who do you get the education from? But I think just that alone and understanding that the level in America, in particular, North America, really, the processed foods, the ultra processed foods, how that impacts us in our mind and our bodies is detrimental.
I saw today, actually, there was news that the FDA finally decided to ban a red food dye number 3, which is known to cause cancer in animals. And it's about time. I mean, unfortunately, we're way behind. In Europe, they have so many of these chemicals already banned, and patients of mine will say, like, oh, I traveled somewhere and I can eat bread there, and when I'm back home, I can't because I feel horrible. And I'm like, yeah, it's sad. And so definitely a huge component of visits here is talking about diet and what you put in your body, and rightly so in your world too, because it affects your amino acids, it affects the way your brain works, your blood sugar, everything is connected to your mood. We joke about being hangry, but it's not, it's a real thing. Your blood sugar's dropping, your body's putting out a signal that says you're supposed to eat now, and you're ignoring me, and so now I'm going to make you feel crazy, or off, and it's not because you're crazy, it's just that you're hungry and that your blood sugar is crashing and that you need to do something about it. So it's really important to have conversations about diet, and I'm glad that you are too, because if you keep putting junk in, you're going to get junk out.
I don't think people understand how much of the neurotransmitters are lining our gut. And it's huge. The vast majority. So when we're talking about, like you said, being hangry or talking about our experiences, and then having that expectation that traditional psychiatric meds are just going to reverse everything without
they're not
without achieving an optimal lifestyle and diet, then those things will not they won't reverse, or they'll reverse to a very, very small, minimal improvement.
Yes, and similarly, I've told patients, I can give you all the supplements in the world, but if your gut is destroyed, you're not going to absorb them,
Right.
and you're not going to get anywhere. So we talk a lot about gut health and the microbiome, and it's huge. And we joke that we're bags of bacteria, which we are, and they can dictate a lot of what goes on, and so it's important. So that I'm glad that you also are on the same page with that. Many of us are busy, us as professionals, we're busy. How do you prioritize your own mental wellness?
I implement different types of strategy on a day-to-day basis, honestly, and then I fit in some self-care days or hours of the week. It really depends. It's, again, everything is a season of change. Different months might be a bit more taxing or in a hustle mode, if you will, than others. But and I share this in my self-care toolkit as well. A lot of these strategies, yes.
It's great. It's got some good tips in it. And I liked it a lot, and some affirmations.
Yes. So in my toolkits, I actually talk about different strategies that you can implement, and they're small, but you would be shocked at.
Hydration was one of them.
Hydration,
drink
sleep,
more water.
How to get better sleep, how to have just mindfulness kind of pauses to your day, check-ins to yourself during the day. What are some of the things and tools that you use? My personal journey, a lot of it has been a lot of education to myself, and being in the medical profession, we are always continuously educating, right?
Yeah.
So, but in practicality, how are those being implemented for ourselves? And so I utilize that, I organize and I structure my day with that. But I also talk about how music has really, positively affected my life. And those people that know me for years, or even are in my season of life, over the past year, music is one of my therapies, genuinely.
Yes. Patients who know me well would know that I am an avid concert goer, so I love music.
Yes.
So yes, I agree. Music can be very, very important, and it can affect our mood greatly. If a song is on your nerves, you kind of get like, oh, and then other times that helps you release. It just depends on the moment. So I love music, and I think that's great that you talk about it, because and it can be, for some people, it can be something else though. It doesn't have to be music.
Right.
It could be reading. It could be going for a walk. It could be, there's so many things that people do. Some people knit, or they crochet or whatever. There's so many things that can be a stress reliever.
Yep.
But music's a great one, for sure.
I love kind of implementing some creativity and utilizing different compartments, if you will, of our brain, and highlighting some of that. And I want that to be used on a day-to-day basis. And journaling even is a part of that too.
I do adult coloring. I love it.
Yes.
I'm always on the quest for cool markers. So.
Yes.
And I tell patients to do that as well, because it's very mindless, and it's not stressful, and it doesn't matter what comes out, because it's your own, and that's the nice part about it. You don't have to be good at it.
Right.
You can just do it. So that's fun. If someone is stuck or overwhelmed, which obviously we all get there, there's a lot going on in the world right now. We're all kind of stressed out watching the fires in LA. We're stressed out. There's a lot happening, So where should someone start? Or if they're unsure to start, how would they even begin to, dive into this?
I think that most people will utilize their community and their resources in their community. And that could be their friend, family circle. That can also be their spiritual or religious circle and network. For sure. And that's great. If you find that that's not really helping for you to progress, then I would advise, looking into mental health providers, whether that's talk therapist, and there's so many variations of that. And then if you're feeling that, the next step beyond that is someone that you want, that resonates with you, that's a psychiatrist or psychiatric provider, then that's kind of like your next step as well. Not everyone needs medications.
For sure.
That's where I support all the spectrums. So if we're talking about more of the integrative, holistic measures, we're doing that in my office. If we're talking more about no traditional psychiatric medications, augmenting with talk therapy and all of these things. Again, it's that customization that we utilize.
Yeah.
So if they're looking for more of someone to mediate and guide them, that's where they should go for professional help and seek that.
Good. Awesome. Well, I really thank you for
having me.
Explaining what you do. It's just nice.
Yes.
I just want patients to know and the public to know that there are a lot of options. We have other practitioners in our office too that do different things in this realm.
Right.
And that's the nice part, is that there's many options and it's what fits best for you. You know, and some people need other things and tools that they use, you know, and other people want to talk.
Yes.
And they want to, you know, and that's fine. Or they need meds or whatever the situation is. So I'm thankful to have met you and have you in part of our network. And that's where I become the resource that you were talking about, to share the information, to get it to the people that need it the most. And that's why I value anytime someone connects me with someone new that can be helpful to my patients and friends and family and whoever else.
I love it.
So thank you so much for joining us.
Thank you.
We'll see you all again soon.
Thank you.
Thank you, everyone.